So these are very exciting initiatives. You guys have so many things going on kind of across the board, but what obstacles and challenges keep you up at night?
Um, Really, it's communication, team communication. Um, you know, I used to work for smaller organizations, 300-bed hospitals, 150-bed hospitals. And so being able to communicate a change within the organization sometimes was a little bit easier. But then when you start going to large organizations like this one, you know, how do we communicate change within the organization effectively so that all stakeholders are aware of that change, is still one that kind of keeps me up at night. When I look at some of our more serious events or events that reach patients, at their heart is team communication. And so that primarily keeps me up at night. Like, how can we do this better? We have all these ways of communicating, whether it's email, text messaging. I think now we're going to have like a system where you could just kind of just tap a button and talk to someone. Will those things really help make us safer? I think that's still yet to be seen. We're trying hard at it, but that one still keeps me up at night.
Yeah, and that's definitely something that's constantly changing,
Yeah.
right? Even how you individually communicate and then across large numbers of people.
Yeah.
So,
I think about the drug shortages, and I know this has been a topic that your team has been working on. It just changes sometimes by the hour, where you might have a meeting, we don't have this in stock, we make all these changes, we start the communication, and then maybe by the afternoon, hey, you guys, we got the drug in. How do you now reverse all that communication that you just sent out, knowing that someone might only read their email once a day, once a week, once a month? They might see one communication and then not see the other one. And so again, those are things that still remain a challenge, I think, for a lot of organizations.
yeah, there's significant safety implications if the wrong communication is communicated during a drug shortage. Not even necessarily the wrong, like you said, delayed or old information, or
Right.
if you're changing by the hour or so, and then everything, and you're getting like 20 emails, how do you prioritize? How do you know with that?
Exactly.
So one question that we have is, what would you say are the most important medication safety issues you're dealing with now?
I would definitely say that, issues around drug shortages and, again, that I touched on about with the communication. And the other challenge with the drug shortages, or any new drug that you're bringing into the organization, now that we have so much technology involved, that it's not as easy as just bringing something into the organization and that we have it available for use in a few hours. I think of, a drug that we bring in, we have to have it programmed into the electronic medical record. Then we have to have it in our Omnicell or automated dispensing. That's a different technology. If it's in the IV room, that's another piece of technology. And each one of these have their own database. All those databases are connected to one another. And so there's a number of checks and balances all throughout all of those. And before you can even have the med prepared and ready to send to the patient. And so, again, with that system being as complex as it is, there's risk inherent in that, in making changes, adding new drugs, making sure all those checks and balances are in place. And then this becomes more of a challenge in areas where you might not have all technology employed. And so you're kind of doing a mix of both, and you have a manual processes as well as technology. So I think a lot about our perioperative areas, which has been a concern for me lately as well too, because of that combination of manual processes and technologies, as well as the culture of safety that are in a lot of our high demand, high stress areas that can sometimes undermine some safety practices that are some of the top things of concern.
What strategies do you use, or what should we keep in mind as we communicate with those that don't have the same background as us, or necessarily see it the same way?
Yeah. This is the way that I see, communication being really important, where soft skills are becoming more and more important as technology takes over a lot of the technical things that we do. It's starting to now rise to the top, the importance of influencing, collaboration, team communication. These are the skills that are really going to help leaders be successful into the future.
So as you're thinking through, I actually also, when I was thinking about communication and how so many people focus on the actual information that they're communicating first, whereas how you're describing it is you are first really talking about the environment. You are creating first the environment. You are trying to understand the environment. You are then looking at the person or entity or whatever it is, trying to understand the dynamics, and then you're thinking about the information,
Yes.
which is very critical steps that people often, I think, forget because we're so focused. What's the exact information? Let me write a perfect email with all the great information and not really understand those other dynamics. So that is
No,
especially
especially with change management. A lot of people think like, and I think it's one that, especially if you're in quality and safety, I know that if I go into the room and I say, hey, Joint Commission says we have to do this, blah, 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 it doesn't mean that it's going to happen. You have to really find ways to influence people that this is the right thing to do. You have to address people's barriers. If you don't address those barriers and help to remove them, your initiative will go nowhere. And so I've also learned that sometimes it takes time for things to come together, and to be okay with that.